Cosmetic and plastic surgery, in a short, is what?
I believe Susruta is the first plastic surgeon in the world to do rhinoplasty. Plastic surgery is not pertinent to any organ system, age or sex.
Cosmetic surgery different from plastic surgery, and what are you doing extra in a cosmetic surgery?
Are very confused.
Ajkal, is it affordable?
Yes, again, madam, that is a misconception or myth. Not related to your celebrity status or economic status. Everybody is concerned about the way they look. It's not very expensive at all.
Do we have to go on repeating it? Do we have to go on coming back to you time and again to do that?
That another very good questions and very practical also. People are into these things without proper knowledge, expertise or equipments. And when I came to Odisha, there was no scope of cosmetic surgery in 2011.
Don't go to quacks. What is a typical cost which would cost her?
It will cost around 20,000.
Is there any side effect? Iska koi kharab side bhi hai?
So, to be very honest, if it is given in a right way, then there will be no side effect.
Okay.
Know your cosmetic surgeon.
Yeah.
That is KYC.
Yes. Which
Skin
age?
And age also. So, routine care.
So what Dr. Sir is telling is cleansing, toning, moisturizing and sunscreen is something which everybody of us know.
I will say it is 20 years of age to 45 or 50 years. 14 years of career. I have done more than 1500 gynae masters.
Nice. I remember this teenager who had tattooed his girlfriend's name in the hand.
Yes.
And then he broke up.
Yes.
So then his father had to spend extra 1 lakh just to get out that tattoo from the hand.
Yes, yes.
So I guess you are doing amazing.
That is, madam, I have experienced those things.
So doing tattoo is a pain and then removing it is also a pain, sir. What is liposuction, sir?
Misconception भी है और डरावना जो videos भी है. So liposuction, if it is done in a right way, then बहुत ही अच्छा है.
Namaskar. I welcome you all for another episode of Kalinga MedTalks. My name is Nilanjana Mukherjee and I am the Managing Director of Kalinga Hospital Limited. As we have started the Kalinga MedTalks, where we will be discussing different topics for the viewers to know exactly what it is all about. Today, we are going to discuss about a very interesting topic, which is cosmetic and plastic surgery. And we have this eminent doctor with us, Dr. Jayanta Das, who is not only a senior consultant with Kalinga Hospital Limited, but also has years of experience and academic acumen on this subject. So I will request Sir to introduce himself. Dr. Das.
Hi friends, Namaskar. I am Professor Dr. Jayant Kumar Das. I am a Senior Consultant, Plastic and Cosmetic Surgery Department, Kalinga Hospital. So I did my super specialization from Maulana Azad Medical College, Delhi. I had a passion for cosmetic surgery, so I went abroad also 2 times in UK. I have done fellowship in cosmetic surgery in Manchester as well as Birmingham. So today I am fortunate to have Nilanjana madam. We will be discussing everything about myth, misconception and spectrum of plastic and cosmetic surgery.
So that's very nice to get you on the forum, sir. So cosmetic and plastic surgery, in a short, is what? What do you do in a cosmetic and a plastic surgery?
Plastic surgery, undoubtedly the least understood specialty, though it originated in 600 BC by Susruta. Probably Susruta is the first plastic surgeon in the world to do rhinoplasty. But unfortunately, because of the term plastic surgery, and it is not pertinent to any organ system, just like if you are considering neurosurgery, then brain or nerve, urology, kidney. But plastic surgery is not pertinent to any organ system, age or sex. So basically plastic surgery, the term plastic is derived from a Greek word, that is plastikos, that means to mold something. So it is more of a reconstruction of defect or deformities over the body to restore function as well as cosmesis.
Okay, so today my next question is, मेरा बड़ा सही सवाल होगा कि कॉस्मेटिक सर्जरी तो सर आप लोग खाली सुंदर बनाने के लिए करते हो. So is cosmetic surgery different from plastic surgery, and what are you doing extra in a cosmetic surgery?
Yes, you have rightly said. The plastic surgery, again, people are very confused. What is reconstructive surgery and what is cosmetic surgery?
So if you see the spectrum of plastic surgery, it can be divided into three subspecialties: burns, reconstruction, and cosmetic surgery. So in reconstructive surgery, what we do, suppose there is a defect because of the trauma, because of the infection, because of the cancer, so we can reconstruct that part. So that is reconstructive surgery. But in cosmetic surgery, the patient is a normal human being, but he's not happy about his or her look. So we can enhance the beauty of that person. So that is cosmetic surgery. So in reconstructive surgery, all the deformities with the different skin grafting, flaps, so many procedures are there. So it is a completely reconstruction because of any defect caused by trauma infection. And the cosmetic surgery, we can restore the function to some extent, but the main aim is to beautify the person with the techniques and principles of plastic surgery.
So on a lighter note, sir, our spouses are never happy with our looks. So I guess we can actually come to you for looking beautiful. That is what I want to say. So sir, my next question, and this is something which everybody asks, is cosmetic surgery is always done by celebrities. Celebrities आते हैं, cosmetic surgery करते हैं, इसको uplift करते हैं, or people who have money do cosmetic surgery. What is your call on that? आजकल is it affordable? क्या है? What is the market trend for cosmetic surgery?
Yes, again, madam, that is a misconception or myth. People think that cosmetic surgery is very expensive. People think that cosmetic surgery is for celebrities, but you'll be surprised to know a girl is coming from a remote area like of Odisha, Koraput, Balangir, and she is interested for rhinoplasty. So it's not related to your celebrity status. It is not related to your economic status. Everybody is concerned about the way they look. So everybody, because of this has happened because of the social media. So everybody, they are posting something on their Facebook or Instagram. So they are very concerned about their look. So that is why cosmetic surgery has become a very common thing for common people, and it is not very expensive at all.
Right. So another question, sir, is that suppose we go in for a cosmetic surgery and we go in for a procedure, do we have to go on repeating it? Do we have to go on coming back to you time and again to do that? Like for example, a lip job or a lifting of a face lift. So is it a recurrent expenditure or it's a one-time expenditure?
Yes, that another very good question and very practical also. I'll say one thing. बहुत लोग आते हैं पूछते हैं कि डॉक्टर साहब ऐसे कुछ कर दीजिए ताकि लाइफ लॉन्ग हमारे फेस में ग्लो रहेगा. तो मेरा आंसर यही रहता है, सपोज आप जिम को एक बार जाओगे तो विल यू हैव ए बॉडी दैट विल लास्ट फॉर लाइफ लॉन्ग. सो कुछ चीज़ें हैं वी हैव टू रिपीट इट एट फ्रिक्वेंट टाइम पीरियड. सो जो इंटरवल होता है, सपोज फॉर एग्जांपल, there is a huge spectrum of cosmetic surgery, starting from cosmeticals to minimal invasive like Botox, filler, thread lift to pure surgical methods. So in Botox and filler, every year the patient, or we call it client, they have to undergo one touch-up. So it's not like once you inject filler injections that will last for lifetime. But suppose we are doing rhinoplasty, so that is the reshaping of the nose. So once you have corrected the deformed or depressed or whatever the nose is, so that will stay for a lifetime. So there are certain things which will last for 1 year. There are certain things which will last for 15 to 20 years. Suppose for example, a lady, she is undergoing the facelift at the age of 40 years. Obviously, with the age, after 55, face will sag.
Yes.
So again, one revision will be required. So it is repeated at certain intervals depending upon the condition and depending upon the treatment we offer.
So sir, are you doing all of this? Are you doing facelifts? Are you doing Botox? Are you doing all of this?
Yes. So now there is a quackery also. So many other professions, they are into these things. But I am being a member of Indian Association of Aesthetic Plastic Surgeon. I am an executive member, and this happens for the first time from the Odisha. I am an executive member. So basically what happens, it has become commercialized. So many people are into these things without proper knowledge, expertise or equipments. I am being a plastic surgeon, we have read everything because I did my MBBS, then MS in general surgery, then plastic surgery. So it has been 12 years of study. And with so many fellowships, so many training, on the spot now I am a national trainer to young plastic surgeons. So what I do everything from non-invasive, minimal invasive and all invasives. And plastic surgery had always been my passion. It has been almost 14 years of my experience after my completion of super specialization. And when I came to Odisha, there was no scope of cosmetic surgery in 2011. But after the COVID period, it has increased a lot. And I do everything, all the spectrum of plastic surgery and cosmetic surgery.
So looking good is a feel-good factor. You know, we all want to look good. We buy expensive clothes because we want to look good. But कितना हम अपने बारे में सोचते हैं is very important. What Dr. Saab said right now is don't go to quacks. बहुत सारे पार्लर्स होते हैं, बहुत सारे स्किन ट्रीटमेंट पार्लर जो आपको बोलते हैं कि हमारा ये लेटेस्ट मशीन है, आप इस पे अपलिफ्ट करा सकते हो, अपना स्कार को निकाल सकते हो. So choose the correct forum and a platform where you go. Now my question to you, sir, is suppose a lady wants to do a Botox or something. What is a typical cost which would cost her in a setup like Kalinga?
Yes. So normally you are talking about the non-invasive treatment. So this is the cost is bit related to the cost of the medication or Botox or filler which we are injecting, and it comes little at a higher price. Suppose for a Botox treatment, if you are giving 100 units of Botox to a patient, it will cost around 20,000 rupees per session. So which will last for almost 8 months to 1 year. Similarly, for a filler, it will cost around 25,000 to 30,000, and again it will last for 1 year. So
अभी मेरा क्वेश्चन आपको है सर कि अभी I do a Botox, I do a filler. What is the side effect of this? Is there any side effect? इसका कोई खराब साइड भी है?
नहीं, एक्चुअली क्या है ना, बहुत रिसर्च होता है. So Botox is very popular terminology from age old. Everybody is very much aware about Botox. So Botox का जो है, filler का है, and other cosmetic procedures also, non-invasive or invasive. So it has been researched a lot to reduce the side effects. So as such, and it is given in a very low dose quantity, so which will produce the cosmetic effect. So it has been FDA approved also. So to be very honest, if it is given in a right way, then there will be no side effect.
Okay.
So that is the thing. Choose the right doctor. Like KYC of bank, you should know where your cosmetic surgeon.
Yeah.
That is KYC.
Yes, yes.
So it is very important.
Yes, because I have actually heard that Botox say, there has been neuro problem and there has been side effects. So this basically what Dr. Sir is telling us is that we should actually go to the right person, and if it is given in a proper way, it gives us benefit. Now, sir, for this maintaining of this after you do a liposuction, a Botox and a cosmetic surgery, do you have these maintenance creams and lotions which also cost you money? Or you are saying that once you do a Botox and then after 1 year you may need it again?
So as a doctor and a cosmetic surgeon, we have the entire background of the patient. Patient is diabetic or patient is some neurological disorder. So we have an entire idea about the patient. So Botox and fillers are given. After that, we don't hide the role of cosmeticals. Because in many areas, many setup, they will highlight the cosmetic or cosmeticals part like cream, those things. But basically, what I prescribe, you don't have to be worried about so many cosmeticals throughout the day. It is very cumbersome to apply also. So as per your age, you choose certain cosmeticals, and basically it is divided into three things. One is cleansing of your face, and second one is sun protection, and third one is moisturizer. And as per the age requirement, whether you will need vitamin C, retinol, hyaluronic acid, peptides, it is up to depends upon your skin
age.
and age also. So it's not very complicated, and you have to use. Don't get carried away by all the advertisement. Also, you stick to basic thing. So you stick to basic things and apply these things, and this is your normal routine care.
So what Dr. Sir is telling is cleansing, toning, moisturizing and sunscreen is something which everybody of us know. हम लोग सब जानते हैं कि ये बहुत ज़रूरी है. अभी मैं जानना चाहती हूँ कि सर कौन से एज में टिपिकली आप देखते हैं कि आपके पास पेशेंट्स आते हैं, एंड व्हेन डू यू थिंक दैट you need a cosmetic surgery? Of course, plastic surgery is if you have a scar and you want to let it go. Like if you have a mole, अगर उसको हटाना है तो आपको जाना पड़ेगा. But what is a typical age where you see in Orissa that you see this is coming?
So typical or common age group, I will say it is 20 years of age to 45 or 50 years. But sometimes there are exceptions. I would like to cite one example. A school-going boy, he is suffering from abnormal enlargement of the breast. That is known as gynecomastia. Now it's a very common, and since my 14 years of career, I have done more than 1500 gynecomastia surgeries. So it is very embarrassing for that boy, and he is being bullied in the school, and he is not focusing on the study. He is undergoing a psychosocial depression. We need cosmetic surgery for that patient. So there are certain exceptions, but the main area is 20 years to 45 years of group, and each group they come with a different expectations. A teenage, I call them insta generation people. They call, I need doctor sir, I need eyebrow lift or fox eye. You can see those celebrities, they have a fox eye. So there are so many things they see on internet, and they have a very high expectation to look like those celebrities. So there are teenage, the surgery or the procedure categories are different. But for middle age, they are also different. Like for 30 to 40, many females, they come for a mommy makeover. So they want their breast reduction, they want their tummy tuck, they want to have a figure like pre-pregnancy period. So they undergo mommy makeover. So each group of people of different age, they come with different expectation from cosmetic surgery.
So on a lighter note, sir, with my years of experience in hospital, I remember this teenager who had tattooed his girlfriend's name in the hand.
Yes.
And then he broke up.
Yes.
So then his father had to spend extra 1 lakh just to get out that tattoo from the hand.
Yes.
So I guess you were doing something.
That is, madam, I have experienced those things. And this is a very common tattoo removal, has become very common procedure. And you will be surprised to the right tattoo in so many areas. So sometimes it is very difficult because it is very deep. So it's very difficult to remove those tattoos also.
Oh, okay. So doing tattoo is a pain, and then removing it is also a pain. Coming to a very interesting topic, since you said that tummy tucking and you mothers want to become as pretty as they were before pregnancy. But I think motherhood is such a beautiful experience that accepting being a mother is a beautiful experience yourself. But what is liposuction, sir? What I mean, liposuction हम लोग बहुत सुनते हैं, बोलते हैं कि यहाँ से फैट निकाला जाता है, वहाँ से निकाला जाता है. But what exactly it is? Can you please explain?
Liposuction, madam, is a very common terminology. उसके लिए बहुत सारे मतलब misconception भी है और डरावना जो videos भी है और reported incidents भी है. So I would like to clarify those things. First, जो liposuction, it's a very simple term. So lipo, lipid, suction means suck out something. So it is the removal of the fat from the body. And many people, they confuse liposuction with bariatric surgery because they think that liposuction is weight loss surgery, which is not true. Actually, liposuction started as a body contouring surgery. It is meant for people those who are very particular for their figure, and they do dieting, they do exercise, they are very particular about diet, but they have some adamant fat on the lower abdomen, thigh or arm, and their BMI, body mass index category, belongs to overweight or grade 1 obesity. So they are the suitable candidate for liposuction. But if the BMI is more than 35, then those persons should undergo bariatric surgery for their weight loss surgery. So basically, bariatric surgery is a weight loss surgery, and it is done or performed by gastroenterosurgeons. And liposuction, it is performed by cosmetic surgeon or plastic surgeons. So those both are very different. और उसमें बहुत सारे जो मिसकंसेप्शन है बिकॉज ऑफ द न्यूज, एज आई सेड अर्लियर, उसमें जो क्वाकरी प्रैक्टिस इसमें भी आ गया. तो छोटे छोटे सेटअप में करना है. जैसे इन कलिंगा वी हैव ए वेरी गुड सेटअप, वी हैव ए वेरी गुड ओटी विथ ऑल द एडवांस्ड इक्विपमेंट ऑफ लाइपोसक्शन. बट क्या होता है ना, बहुत लोग कुछ सीख लेते हैं फिर छोटे छोटे नर्सिंग में करते हैं, दे डोंट हैव आईसीयू बैकअप, तो उसमें तो जरूर कॉम्प्लिकेशन होगा, एंड यू डोंट हैव एनीथिंग टू मैनेज दैट थिंग आल्सो. सो लाइपोसक्शन इफ इट इज डन इन ए राइट वे देन बहुत ही अच्छा है. और जो इट इज ए लाइक ए रिन्यूइंग ऑफ योर फिगर. सो उसमें आप जैसे ही नॉर्मली या तो बिकॉज ऑफ द फूड हैबिट आपका फिगर खराब हो गया, और बिकॉज ऑफ द प्रेगनेंसी आपका फिगर खराब हो गया, तो लाइपोसक्शन में जो टिपिकल सबका एक आवर ग्लास फिगर एक रहता है कि हम लोग का फिगर ऐसे होना चाहिए, तो लाइपोसक्शन में बहुत ही अच्छा रोल आता है. और इट्स ए वेरी सिंपल सर्जरी एंड वी डोंट टच एनी इंटरनल ऑर्गन. As you say, you have heard beauty is skin deep. So liposuction is like that. So skin के नीचे जो फैट होता है ना, छोटे से होल से वो फैट हम निकालते हैं. And it can be done over all the areas of the body. Suppose आपका डबल चिन है, तो आपका चिन से वो डबल चिन कैन बी करेक्टेड थ्रू liposuction. Suppose आपका आर्म में बहुत फैट है, वहाँ से भी कर सकते हैं. लोअर एब्डोमेन में फैट है, वहाँ से भी कर सकते हैं. थाई से कर सकते हैं. पीछे का जो ब्रा बेल्जेस, साइड में लव हैंडल्स, तो सारा इट्स ए बेसिकली बॉडी कंटूरिंग सर्जरी. और हर एक एरिया में छोटे छोटे होल होता है और वहाँ से जो फैट निकल आते हैं. और इसका भी बहुत मतलब लोगों में दिमाग में है कि इतना सर्जरी क्यों कराना है अगर जो नॉन सर्जिकल मेथड्स अवेलेबल है. बट उनको ये भी पता नहीं कि जो नॉन सर्जिकल, सपोज इफ यू आर यूजिंग सम एनर्जी, से इट अल्ट्रासाउंड, से इट जो फ्रीजिंग और लेजर जो भी आप यूज कर रहे हो ना, उसमें हार्डली 200 ml और 300 फैट ऑब्जर्व होगा एक सेशन में. और आप सोचो कितने सेशंस आपको चाहिए होगा. हालांकि ये नॉन सर्जिकल है, यू डोंट नीड हॉस्पिटलाइजेशन, बट इसमें जो फैट ऑब्जर्वेशन होगा, जो फैट लॉस होगा, बहुत ही कम क्वांटिटी का होता है. दैट व्हाई दे एडवाइस फॉर मल्टीपल सेशंस. और उसमें खर्चा भी बहुत आता है. लेट्स से वन एग्जांपल, एक अगर लाइपोसक्शन में कराता हूँ नॉर्मली जो लोअर एब्डोमेन का, तो एक सिटिंग में आई टेक आउट अराउंड 5 to 7 liters ऑफ फैट. वो कॉस्ट आता है, फॉर एग्जांपल कलिंगा हॉस्पिटलिटी पे कॉस्ट अराउंड विद इन 1.5 लाख. बट आप जो मल्टीपल सेशंस कराते हो नॉन सर्जिकल, सोचते हैं कि वो सेफ है, आई विल नॉट, जो आपका अप्रेंशन है वो होना नहीं चाहिए. आजकल तो एनेस्थेटिस्ट बहुत बढ़िया आ गए हैं, तो हॉस्पिटल्स का जो सेटअप अच्छा है, बैकअप अच्छा है, तो रिकवरी टाइम इज ऑल्सो क्विक. बट उसमें क्या होता है ना, आप हर एक सेशन का 1-1 लाख दे के 8-10 लाख खर्चा हो जाता है. यू कैन सी द डिफरेंस. और रिजल्ट भी उतना नहीं आता है जितना आपका लाइपोसक्शन में आता है.
So, Dr. Sir, what you're trying to tell us is that liposuction is a very common thing right now. People are doing body contouring. But मेरे को एक चीज़ बताइए सर कि इसका कोई साइड इफेक्ट्स है? And second thing is what I could understand that once you do liposuction, you have to maintain yourself. ये नहीं कि आप gymming and gym and exercise and diet छोड़ दे. So I would go back to the question that what is the myth and what is the side effects if I go for a liposuction?
तो मैडम जो लाइपोसक्शन होता है, देयर आर रिपोर्टेड इंसिडेंट्स. एक जो फैट एम्बोलिज्म होता है, बट नाउ इट हैज रिड्यूस्ड ए लॉट. इनिशियली जब लाइपोसक्शन शुरू हुआ था उस समय इंसिडेंट ज़्यादा होते थे, अब बट इट हैज रिड्यूस्ड ए लॉट. ऐसे मतलब पूरे इंडिया में जितने लाइपोसक्शन होता है हार्डली 0.01% भी नहीं होता होगा इतना इंसिडेंस. तो एक तो वो एक इंसिडेंस है. दूसरा, देयर आर सर्टेन प्रिकॉशंस सपोज लाइपोसक्शन लोग सोचते हैं, एक्चुअली हम लोग क्या ना एक फेस करते हैं, जब भी कोई कॉस्मेटिक सर्जरी कराने आता है ना, दे आर ऑलवेज इन अ हरी, डॉक्टर साहब जल्दी करवा दीजिए, कल ही मुझे लाइपोसक्शन कराने. बट वी शुड प्रिपेयर द पेशेंट फॉर द सर्जरी. वी शुड हैव ऑल द इन्वेस्टिगेशंस, एनेस्थेसिया चेकअप, उसका कोई कोमॉर्बिडिटीज तो नहीं है, डायबिटीज, कार्डियक चेकअप, सब कुछ होना चाहिए. उसमें ना कॉम्प्लिकेशंस बहुत ही रिड्यूस हो जाते हैं. तो नेवर बी इन ए हरी. अगर आपको कोई कॉस्मेटिक सर्जन बोला है हाँ जल्दी करा देंगे, यू थिंक ऑफ इट्स वाइज. इट इज ए प्लान प्रोसीजर, इट इज एन इलेक्टिव प्रोसीजर. डोंट बी इन ए हरी. हमेशा अच्छा सा समझ लीजिए कि क्या प्रोसीजर है, क्या आउटकम है, सब कुछ, देन यू अंडरगो फॉर सर्जरी. तो उसमें क्या होता है ना, इफ यू विल डू इट, प्रिपेयर द पेशेंट वेल एंड यू विल डू इट राइट वे, पोस्ट ऑफ केयर अगर अच्छा हो तो कॉम्प्लिकेशन बहुत ही मिनिमाइज होता है. तो हालांकि मतलब इट्स almost there is no complication side effect. And there are certain things also, like बहुत लोग छुपाते हैं, they have certain addiction like smoking. If the patient has a smoking habit, so liposuction is contraindicated. So at least 2 हफ्ता उसको बंद करना पड़ेगा स्मोकिंग. तो ये लोग भी छुपा देते, तो उसमें ना कॉम्प्लिकेशंस भी आता है. तो वी हैव टू प्रिपेयर द पेशेंट वेल. और बाकी जो रहा कि आपका जो पोस्ट ऑफ केयर मैडम आपने कहा, तो यस इट्स ट्रू, you have to maintain the same diet and exercise you are maintaining
To continue that.
So otherwise क्या होता है ना, if you are happy that my fat is lost, I can eat everything.
No, that doesn't happen.
There will be again fat regain.
So what is the typical duration of stay, sir?
Duration stay mostly 2 days only.
Okay.
Patient is prepared well, get admitted the day of before surgery, then and the patient is discharged after the day of surgery. So
I think, sir, we have got very advanced machines which you have
Yes.
you recently ordered very high-end machines which you were mentioning.
Yes. So basically, after the surgery, patient can ambulate or walk also, and patient can do day-to-day activities. On the second day, yes, it is not advisable to do gymming or heavy strenuous exercise for 2 weeks. After that, she can lead a normal life. And yes, she has to maintain the diet and exercise, and she has to wear one pressure garment, that is body saver, just to facilitate the contraction of the skin.
Okay.
Because it's like that skin is elevated because of the fat. Once the fat is removed, then the skin should contract properly, so that there will be reset. And there are certain energy devices nowadays. When I started my career in liposuction, I was doing suction assisted liposuction. Now there is power assisted liposuction, and to add it, we can melt the fat with the laser also, ultrasound. Then you can tighten the skin with the body tight or radio frequency devices. And I am fortunate that all the things are available in Kalinga. So it is a very good thing, and we have all the facilities for a good liposuction.
So you mean to say, तो हम पहले liposuction किए, you take out the fat,
Yes.
and then you do a body tightening
Exactly.
in the same session.
Same system.
Okay, that's a very nice thing. So sir, there is a very important part which I want to address, that is, these are all very private things. आप जब cosmetic surgery कराते हो या liposuction कराते हो, you're not very open about it. So do you face challenges as to the privacy of the patient? How do you manage the privacy? Because this is nothing where everybody speaks aloud.
Exactly. Cosmetic surgeon, actually, they trust us. People or patient, they trust us. So we should maintain that value. So जब भी patient आता है ना, I spend a lot of time for counseling. बहुत ही अच्छा सा बात करता हूँ, make the patient comfortable. And I never share photograph of the patient on social media. आजकल बहुत ही ये हैबिट हो गया, सारे जो यंग प्लास्टिक सर्जन्स और जो अदर को वो बहुत ही शेयर कर लेते हैं. तो एक्चुअली टू बी वेरी ऑनेस्ट, आप पेशेंट का फोटोग्राफ इट्स नॉट ए प्रॉपर्टी फॉर यू, सो आप वो नहीं शेयर कीजिए. और दूसरा चीज़ है कि पेशेंट का जो भी कंसर्न है, प्राइवेसी है, तो आपको यू हैव टू वेरी पर्टिकुलर. आपको जैसे मार्किंग वगैरह करते हो, लाइपोसक्शन पहले मार्किंग भी कर रहे हो. आई नेवर डू इन द ओटी. मैं हमारा जो पर्सनल रूम होता है, नर्सिंग स्टाफ एक रहते हैं वहाँ पे, आई मेक द पेशेंट कंफर्टेबल, वहाँ पे मार्किंग कराता हूँ. फोटोग्राफ्स लेता हूँ फॉर द एजुकेशन पर्पस, जब भी पढ़ाना होता है किसी को, और टू सी द रिजल्ट ऑल्सो, कैसा रिजल्ट आया, कैसे ट्रांसफॉर्मेशन आया, तो उसको रिसर्च पर्पस के लिए फोटोग्राफ्स हम लेते हैं. और दूसरा चीज़ ये थे कि जो पेशेंट का जो एक्सपेक्टेशन शुड बी मैच्ड विद द रियल साइंटिफिक मेथड। हम लोग का सबसे बड़ा जो चैलेंज होता है अनरियलिस्टिक एक्सपेक्टेशंस। बहुत टाइम पेशेंट कम्स विद जो ओबेसिटी, grade 1 obesity, and they think that after liposuction my figure will be like Malaika Arora, which is not true। मतलब ऐसे नहीं हो पाएगा। तो अगर आपका ओवरवेट कैटेगरी आप ऑलरेडी स्लिम ट्रिम है तो मलाइका अरोरा के टाइप जो एब्डोमेन हो पाएगा, बट सो एक्सपेक्टेशन शुड बी मैच्ड विद द रियलिटी, सो दैट इज वेरी इंपॉर्टेंट and we have to create a balance between expectation and the scientific approach.
So that's an amazing thing that you actually said, is that, you know, I just can't get up in the morning and think that I will look like Malaika Arora. We have to work toward it. There is a lot of dedication and hard work. But to come back to the end of this session of cosmetic and plastic surgery, we had an amazing session on what is cosmetic surgery and what is plastic surgery. Liposuction is much doable. Now, as a healthcare professional for past 20 years, I have seen that because of the social media, there are a lot of depression and mental issues in the youngsters, where they feel they're ugly, they feel they're not up to the mark. Instagram, Twitters, everywhere you see people they just don't feel beautiful about it.
Yes.
Here we have somebody who makes us feel beautiful and works on our beauty. Coming back to the end of Kalinga MedTalk, any questions you can always ask us. Dr. Jayanta Das is available at Kalinga Hospital. Only suggestion, please go to authentic doctors. Please go to doctors who are qualified for this, and not get motivated by people and by advertisements and by clinics which do not have the infrastructure. So it is your choice and we are there to serve you. So namaskar and thank you for the session. We will come back for next week for another session of Kalinga MedTalk. Thank you.